Hi, my name is Kathy Crowe and I'm a stroke clinical nurse consultant. You have been identified as a high-risk stroke patient because of the fact that you've actually had a stroke or a TIA, which is a small stroke. The information we will be providing you in this DVD will help reduce your risk of another stroke. Firstly, we will explain why self-management is so important. We will take you through some practicalities about living a healthier lifestyle. We will also look at some of the complications and issues that can be associated with strokes. And finally, we will let you know where you can find the support you need to make these lifestyle changes with some help to reduce your overall risk of further strokes. There are some strategies you can use to decrease your risk of further strokes. Some of these strategies include self-management principles. This will be your health record. I'll put your blood pressure management and your blood pressure details in here. There are 7 principles of self-management. The first one being know your condition. The second one is to be actively involved in any decision-making regarding your condition. The third one is to follow a care plan if you can and agree on what you can do and write it down. The fourth is to monitor your symptoms such as your blood pressure management and also your blood sugar levels. Please write them down and make sure that you're aware of what they are on a daily basis. Respond to any changes. If your BP is elevated or your sugars are elevated, please let someone know and make sure that someone is aware. And try to manage some of those components as you would by dietary, particularly if your sugars are elevated and you're diabetic, you know what you can do. And if you don't, we can actually make a referral to the diabetic clinic for you on your behalf. And finally, adopt a healthy lifestyle. If you do all these things to help self-manage your condition, you will decrease your risk of further stroke.
Hi, my name's Bronwyn Jenkins. I'm a neurologist. Positive lifestyle changes can help you reduce your risk of a further stroke. These include diet and exercise. High blood pressure, cholesterol, diabetes and smoking can all harden the arteries. These are often occurring silently without any symptoms until a sudden event like your stroke occurs. You've had a stroke, don't wait for another warning. Take note of any risk factors you have and make the necessary changes now. By modifying your diet and activity, you can help take control of your risk factors and reduce the risk of a further stroke. Your doctor will also give you necessary advice about long-term medications to reduce your risk of stroke, which will depend on the individual cause of your stroke.
Hi, my name's Luke Gibson and I'm a dietitian. Decreasing your risk of having another stroke should be a high priority. Modifying your diet can help to reduce your risk. Making small changes to your diet now can make a big difference in the long run. By modifying your diet, you can also decrease the amount of medication you take. Eating a healthy, balanced diet is the key. The Australian Guide to Healthy Eating can help us visualise what makes up a balanced diet. It also shows how much food we should eat from each food group. Cereals and grains make up the largest section. Foods with whole grains are the healthiest. Vegetables and fruit make up the next biggest section, and you should try to eat 5 serves of vegetables and 2 serves of fruit every day. The milk, yogurt and cheese group is important for bone health, and we should try to choose low-fat options. Meat, fish and poultry are next, and 1 serve from this group is enough for a balanced diet. The extras group down the bottom doesn't even make it onto the plate. This section represents processed foods which have little nutritional value. They also contribute to weight gain, diabetes, high blood pressure and high cholesterol. Now let's look at some good and not so good meal choices. The first meal is a typical unhealthy takeaway meal, whereas the second meal is a healthy takeaway option. Let's talk about the reasons why the unhealthy takeaway meal can increase the risk of you having another stroke. The unhealthy takeaway meal will cause your bad cholesterol to increase. The saturated fat in this meal contributes to increasing bad cholesterol by depositing it in your arteries. In order to try and reduce the amount of saturated fat in your diet, you should trim visible fat from meat, limit the amount of takeaway food that you eat, and only eating biscuits, cakes and pastries on special occasions. Good cholesterol, however, helps remove bad cholesterol that's built up on your artery walls. Healthy fats like mono and polyunsaturated fats help to reduce bad cholesterol and increase good cholesterol. These healthy fats are found in plant foods such as olives, canola, nuts, grains and avocado. Fish contain the healthy omega-3 fats. 2 serves of fish every week, including tinned fish, should be enough to help reduce the level of bad cholesterol in some people. The second reason why the takeaway meal might increase your risk of having another stroke is because it could increase your blood pressure. Salt or sodium is the enemy of blood pressure. This takeaway meal is extremely high in salt, as with most foods eaten outside the home. Controlling your blood pressure is very important if you're trying to decrease your risk of having another stroke. Some ways to limit the amount of salt in your diet are: aim to stop adding salt to foods you eat, only having takeaway and processed foods occasionally, and by choosing no added salt or salt-reduced products when you can. Once you reduce the amount of salt you eat, your taste will eventually change and you'll start to taste the food rather than the added salt. Eating lots of fruit and vegetables can also lower your blood pressure. The third reason why the takeaway meal might increase your risk of having a stroke is because it can contribute to weight gain. Takeaway foods are very high in calories. When you get lots of calories from the food you eat and you don't burn them off during exercise, you can put on weight. Losing weight if you are overweight can decrease your risk of having another stroke. Eating foods that are lower in calories help you to lose weight. Filling up on vegetables rather than fatty and fried foods can help decrease the amount of energy in your diet. Recognizing when you are hungry and when you are full is important. Stop eating if you aren't hungry anymore. Don't keep eating just because the food is in front of you. Our portion sizes are too big. Most people eat way too much food compared to the amount of daily activity they do. Being overweight can lead to diabetes. Many people have diabetes and don't know it. If you haven't been tested recently for diabetes, talk to your GP about getting tested. Uncontrolled diabetes increases the risk of you having another stroke. If you do have diabetes, make sure you visit your GP regularly and discuss changing your diet with a dietitian. Any type of food can be eaten as part of a balanced diet. It just depends on how much and how often. Overall, the most important thing to remember is eat more fruit and vegetables. They are the key to good health. Eat small amounts of lean meat and try to include fish at least twice every week. Choose whole grains and low GI foods. Try to eat smaller portions. How hungry are you really? If you have any questions or would like to know more about changing a diet in order to decrease your risk of having another stroke, contact a dietitian near you. Changing dietary habits takes time and effort. Get support from those around you. Inspire them to eat healthy the same way that you are. Eat well and stay healthy for life.
Hi, my name's Karen Waller and I'm an exercise physiologist. Exercise is a vital part of rehabilitation after a stroke and aids in preventing further strokes. The benefits of these include a reduction in blood pressure, a reduction in your bad cholesterol, decreased risk of a further stroke, decreasing your risk of cardiovascular complications and diabetes, decreasing falls and osteoporosis, as well as decreasing your stress. As well as this, there's also an increase in your muscle mass, an increase in your good cholesterol, increases in strength, flexibility and endurance, and also increases in bone strength. In the early stages after your stroke, your exercise will gradually be increased under the guidance of therapists. After returning home, there are several ways you can continue your fitness regime. Some people choose to continue an individualised program of exercises such as walking and home resistance training. Others choose to join a group such as aerobics classes to take part in exercise as a social activity. Choosing activities that you will enjoy makes it more likely that you continue this positive change. Some people find it difficult to find the time to schedule exercise into their busy lifestyles. These are a few simple ways you can increase your physical activity throughout the day. Taking the stairs instead of the lift, getting off the bus one stop earlier and walking the extra distance, active housework and gardening, as well as moving around your lounge room in between ad breaks. If you are experiencing a lack of motivation or do not feel able to perform an exercise program by yourself, or if you would like to get in contact with an organisation for added enjoyment and a social atmosphere, please contact your local doctor for an appropriate referral. Exercise is a planned physical activity which is performed to improve your physical fitness, performance, health and social interaction. The National Stroke Foundation recommends performing at least 30 minutes of moderate intensity physical activity on most days of the week.
Hello, my name's Susan Day and I'm a nurse. Continuing to smoke after a stroke increases your risks of further strokes. There are several reasons for this. The nicotine in the cigarettes increases your blood pressure. The cigarettes cause fatty plaques in your arteries. Carbon monoxide decreases the amount of oxygen that travels to your brain, and the cigarettes make the blood thicker and causes clots. Even 2 cigarettes a day can increase your risk of a further stroke. By stopping smoking and encouraging your family and friends to also stop smoking is a positive step in your recovery and your future health. Giving up is difficult, so ring the quit line to seek help. If you don't drink alcohol, please don't start. But if you do drink alcohol, we ask you to limit your intake. For women, we recommend up to 2 standard drinks per day for 5 days per week, with 2 alcohol-free days per week. For men, we recommend up to 3 standard drinks per day for 5 days, with 2 alcohol-free days per week. As previously described, there are several ways you can reduce your chances of a recurrent stroke, and one is to take the prescribed medications that have been shown in trials to reduce stroke.
What time of the day and should I take the medication with or without food?
These medications are to be taken long term and should not be stopped unless in consultation with your doctors. It is also important to discuss any over-the-counter, alternative and herbal medications that you take with your doctor, as some of these medications interact with the prescribed medications and can increase or decrease the effects, particularly warfarin, and may cause harmful, unnecessary side effects.
It's probably your tablets to prevent another stroke's more important, so if you don't need to be on that, that'd be best left aside. Healthy lifestyle and the medications prescribed by a doctor can work in harmony to reduce the risk of a further stroke. Neither of these are a short-term option like a course of antibiotics. They are both lifelong strategies to adopt. Simple changes in your lifestyle can be a powerful tool to improve your enjoyment of life and your long-term survival.
Hi, I'm Jane Marie Hunter, the Nurse Unit Manager of a Stroke Unit. Many people feel depressed after having a stroke. About 1 in 3 people affected by stroke do report depression, especially 6 months to 2 years after the stroke. Caregivers struggling with new responsibilities and roles are also at risk of becoming depressed. Remember that depression is not a sign that you are weak or not trying, and it is not something that you can just simply snap out of. Depression is common following a stroke, as the person has to make a lot of adjustments. Although depression is common after a stroke, sometimes treatment is required. If you or a family member is concerned about this, please discuss it with your doctor. It is important to be aware of the fact that some medication used to treat depression can take up to 6 weeks to have an effect. If your doctor does decide that medication is required, be sure to discuss any issues with them and never stop taking it abruptly. Look for other activities that may make the person happy or improve their morale. Sometimes local support groups can help with this type of thing because you are interacting with people who have been through a similar experience. You may need to get further medical follow-up if symptoms are ongoing.
I'm Dr. Jonathan Sturm, a neurologist. Sometimes a patient may have a seizure at the time of their stroke or may go on to develop recurrent seizures after their stroke. A seizure can affect someone's behaviour or their level of awareness. Sometimes a seizure may cause jerking movements of the face or limbs, or a strange sensation in the face or limbs. Most seizures don't last very long, a few minutes at most. First aid. Do not restrain the person. Protect the person from obvious injury by placing something soft under their shoulders and head. As soon as possible, roll the person onto their side to assist with their breathing.
Just lift this knee up, mate. I'm gonna put you on your side. You've just had a seizure.
Stay with them, protect and reassure them until they're fully recovered. If a seizure occurs and doesn't stop within 5 minutes, or if a seizure does stop but then another one starts very soon after the first, call an ambulance. If not, see your doctor the next day to discuss tests and possible treatment.
My name's Chris Brown. I'm an occupational therapist. Stroke affects people's ability to drive in a number of ways. And because of this, it's important that you are assessed as being fit to drive before you return to driving. Although you have been driving for a number of years faultlessly, your stroke may make what was not a problem in the past unsafe now. The RTA has guidelines about when a person who has had a stroke returns to driving. You should be given information on the follow-up for your driving skills prior to your discharge from hospital or the rehabilitation ward.
Hi, my name is Leanne and I'm a social worker with the Stroke Unit. After a stroke, the person may be unable to return to work straight away. They may be able to use their sick leave entitlements or income protection insurance if they have it. If the person has no leave, then they may be eligible for Centrelink payments. A carer of a person following a stroke may also be entitled to Centrelink benefits. Sometimes a gradual return to work is required, such as reducing the hours that you work, changes to what tasks you do, or even alternative employment or retraining may be necessary. There are a number of organisations that can assist with return to work, and a social worker can help you to access these services. A stroke serves as a reminder of the importance of keeping one's financial and legal affairs in order. A social worker can talk with you about alternatives for financial decision making. Occasionally, a stroke may permanently affect the person's decision-making abilities. Difficulty in communicating does not necessarily mean that the thinking and memory are impaired. There are legal means of helping people with financial affairs and making decisions which are different from a will, but this requires careful consideration between family, doctors and solicitors.
Hi, my name's Sue Kerr and I'm a speech pathologist. After a stroke, many people experience some form of communication difficulty.
Socks.
Dysphagia refers to a breakdown in language ability. A person may have difficulty talking because they can't find the words they want to use, or they may have difficulty understanding. Dysarthria refers to the sound of someone's speech. A person's speech may sound slurred and they may be difficult to understand.
Paul.
Good. A speech pathologist helps people regain their communication. When talking to someone with a communication difficulty, speak slowly and simply, ask yes/no questions, and encourage the use of gesture. After a stroke, some people have problems swallowing and may be at risk of food or fluid entering the lungs and causing pneumonia. A speech pathologist may recommend thickened fluids or blended foods for safety. When swallowing, make sure the person is alert and upright and takes their time eating or drinking.
Hi, my name's Jenny Burrows. I'm a clinical nurse consultant who works in the area of stroke. Sexual intimacy is a very personal issue. But there is no reason why somebody who has had a stroke can't continue to have an intimate relationship. There are a number of activities that can increase your heart rate and make you breathe a lot harder, but these won't necessarily make you have another stroke. If you have concerns over this issue, please talk to your doctor about it. Physical changes can interfere with sexual relations, and accepting these changes can take time, effort, and honest communication. Medications can also interfere with sexual ability and desire, so I'd like to give you a few suggestions. Don't feel that you have to have sexual intercourse in order to show love for your partner. Hugging, kissing, touching, and massaging can all show love and affection. Plan ahead for intimacy at a time when you and your partner won't be interrupted and when you're both rested. If you had slowed sexual responses, you can allow enough time for lovemaking. If you are the partner, approach your mate from their stronger side. and describe what you're doing. Changing position and using pillows to support weak limbs can aid in comfort and support. Memory problems and concentration can affect the sexual experience, so try to undertake it in a quiet, familiar place. Sometimes after a stroke, people can have problems with bladder and bowel control. Try to ensure that you go to the toilet to help prevent any accidents and keep clean-up equipment close at hand just in case. If you're a woman and birth control is an issue, please discuss the options with your doctor, as some medications can interfere with medications that you're already on. If you're trying to fall pregnant, discuss it with your doctor first.
Hi, my name is Michelle Jones. I'm an occupational therapist. Even a mild stroke can affect your memory, thinking skills and attention. These are some ways in which your memory loss or difficulties with thinking can impact upon your daily life. You may be able to remember events that happened before the stroke, but have trouble learning and remembering new information. You may have problems applying information to a new setting. You may have difficulty doing something without being reminded or prompted. You may become confused or lost in what should be a familiar environment or lose track of the date or time. You may have problems with your memory and planning, which impacts upon your thoughts and decision-making processes. You may have a limited attention span, making it hard to remember, use and act upon information. So what can you do? Talk to your doctor or your therapist about getting help with your memory and thinking difficulties. There are also some strategies or techniques that you can put into place with your caregiver to help you to overcome these difficulties. Firstly, you can write down or tape recording a message which can help you to go back and refer to it later. Repeating the information can sometimes help you to remember a long list. Be patient with yourself. Getting angry and frustrated will only make it harder to remember. Concentrate on one thing at a time. Remove any distractions such as the television or radio. Use memory aids such as an appointment book, written notes, lists and schedule cards to keep track of what you are supposed to do. Break tasks or messages into smaller steps and finish each step one at a time. Avoid rushing into things. Stop and think before you start a new task. And finally, allow your family and friends and caregiver to help.
Hi, my name's Michelle Sharkey. I'm the Executive Officer for the Stroke Recovery